My name is Arnaldo Olivera, and we're going to talk about healthcare or disease care. But before I do that, I want to thank you, first of all, Jesus, who is my Lord and Savior, and all healing comes from Jesus. And secondly, I want to thank Pastor Gary and Candace and New Hope for this wonderful ministry. So the talk about healthcare or disease care will lead us to inevitably to talk about chronic disease. So we're going to spend quite some time talking about what is chronic disease, a few of chronic diseases that we have right now in our communities, and then I'll talk about a few strategies to help us prevent and treat chronic disease in a natural way. So how chronic disease affects us? How can we prevent chronic disease? How chronic disease can be effectively treated? So we're going to delve into these questions and trying to answer them. First of all, what is chronic disease? What chronic means? So chronic means, it comes from the Latin word chronikos, which also comes from the Greek word chronos, which means time. But in healthcare, chronic disease means a time bomb. It'll be just a matter of time until it really affects your quality of life and eventually will lead to our demise. Chronic disease, by definition of the U.S. National Center for Health Statistics, is any disease that lasts more than 3 months. So that's the basically, if you have a condition that you have for more than 3 months, we can consider that to be chronic disease. Some folks would consider chronic disease a condition that lasts over 12 months. Multiple causes lead to chronic disease. For example, diet, lack of exercise, lifestyle choices such as alcohol abuse, smoking, use of drugs, lack of sleep, not drinking enough water, the environment, like pollution in the air, in the soil, in your house, in your office, but also genetics. The cost of taking care of chronic disease is an increasing problem. So 6 in 10 Americans have at least one chronic disease, one chronic condition. But 4 in 10 have 2 or more chronic conditions. In terms of numbers, if we are 325 million Americans, so 60% of this population will be 195 million people with one chronic disease. And about 130 million with more than 2 chronic conditions. So this costs a lot of money, as you can see in the slide, but I want to show you how chronic disease, the cost of chronic disease is spread out in healthcare spending. So basically, we spend about over 20% of the cost of the cost of taking care of chronic disease patients in hospitals, visits and procedures. About 20% of that is for physicians, so visits and other costs involving the physician care. But we also have the prescription costs, which is about 10%. So over 60% of all costs in chronic conditions are, the major costs are spread out into hospital, physicians, and prescription. Under current law, the national health spending is projected to grow to an average rate of 5.5% from last year to the year 2027. And we believe that this is going to reach $6 trillion by the year 2027. The scope of cost of chronic disease continues to rise and is unstoppable. For example, hospital spending is projected to accelerate to 5.7% a year for the next 7 years. Prescription drugs is also projected to increase exponentially. So the question is, what are we doing to minimize not only the costs, but to actually prevent that people get chronic disease? So what is killing us? As you can see in the slide, the things that are killing us are the same from the past 10, 15 years. We have heart disease, we have cancer, Alzheimer's, diabetes, stroke. These are the things that if we look back in different years, maybe 10 years from now, 15 years from now, are the same things that are making our community suffer, like premature death, suffering, and also increasing spending in healthcare. Last year we spent in healthcare about 18% of our nation's GDP. It's a lot of money. I believe, I don't have the figures here, but I think it's more than the defense and homeland and education budget together. But all of these diseases are still prevalent and killing us every year, despite the amount of money we're spending. So most causes of death in this chart come from chronic disease, as you can see. But for the sake of time, I want to talk about a few chronic diseases that are more prevalent. So let's start with heart disease. For example, in heart attacks, possible causes include chronic high blood pressure, chronic stress, inflammation in general. So heart disease. So this is a picture of the heart. This is a perfect heart. So I put in there so we can see how the heart structures look like. And basically, problems in the heart are in a few different areas. So we have coronary artery disease. The coronary artery system is the veins and the arteries that feed the heart itself, so it can continue to pump and to work. So we might have problems in that area caused by chronic disease, like for example pollution, viral infections, dietary choices that will eventually clog up the vessels. We also have heart disease caused by valvular heart disease. As you can see in the picture, the heart has a few valves that open and close. We have the pulmonary valve, we have the tricuspid valve, we have the mitral valve, and we have the aortic valve. So these valves can become diseased. That will cause a lot of problem as well. We also have a disease in the heart that's caused by how the muscle of the heart is affected. We call it cardiomyopathy. And there's several causes for that. But inflammation can be a big one, and especially chronic inflammation. We also have heart rhythm problems, we call arrhythmias, and we have heart infections like viral infections and bacterial infections. And we have also structural problems that develop before birth, we call congenital. In terms of heart disease, about 16 million heart attacks and strokes are related heart-threatening events that could happen in 2022. So one of these three life-changing cardiovascular events will happen in adults 35 to 64 years old. So, and 80% of premature heart disease and stroke are preventable. How much in numbers are heart circulatory disease affects us? For example, in 2016, it was about 775,000, 100,000 hospitalizations and 75,000 deaths. So let's jump from heart disease to cancer. Cancer is the second leading cause of death in this country. Despite advances in medicine and the way we treat cancer, we see new cases increasing, and we spend a lot of money in treating cancer patients. But cancer is basically, it's a group of more than 100 diseases, different diseases. It can develop almost anywhere in the body. How cancer begins? Well, cells are the basic units that make up the human body. Cells grow and divide to make new cells as the body needs them. Usually cells die when they get too old or damaged. Then new cells take place. But sometimes this natural process is disrupted, and so we believe that cancer begins when genetic changes interfere with this orderly process, natural process of cell life. So the cells that's damaged, that has a damaged DNA, it starts to grow uncontrollably. These cells may form a mass called a tumor. A tumor can be cancerous or benign. A cancerous tumor is malignant, meaning it can grow and spread to other parts of the body. A benign tumor means that the tumor can grow, but will not spread. Some types of cancer do not form a tumor, and these include like leukemias, most types of lymphoma, and myeloma. This is a picture that I like to. It presents how the normal cells are, and then how cells that are different from normal to hyperplasia, dysplasia, and cancer. In hyperplasia, there is an increase in the number of cells in an organ or a tissue that appears normal under the microscope. In dysplasia, the cells look abnormal under the microscope, but they are not cancer yet. Hyperplasia and dysplasia may or may not be cancer, but if you look at the picture of cancer, you see that the cells that are normal are projecting out of the normal layer in the tissue. For example, lung cancer starts in the cells of the lung, and brain cancer starts in the cells of the brain. In the US, in 2019, there will be an estimated 268 new cases of invasive breast cancer diagnosed in women. Liver cancer is the most rapidly increasing cancer in both men and women, with incidence rates more than tripling since 1980. From 2006 to 2015, the rate increased by about 3% a year. Cancers also may be described by the type of cell that formed them, such as an epithelial cell or a squamous cell. Carcinomas are the most common type of cancer. They are formed by epithelial cells, which are the cells that cover the inside and outside of surface of the body. And sarcomas are cancers that form in bone and soft tissues and connective tissue. This shows a small cell lung cancer, which is a carcinoma of the lung. This next slide shows a chondrosarcoma, which is a cancer of the connective tissue, in this case near the spine. Sarcoma is a tumor that affects the connective tissue, like I said, and soft tissue sarcomas, as the name suggests, affect the soft tissue that may include fat, muscle, sometimes blood vessels, deep skin tissues, cartilage, tendons, and ligaments. There is an association between overweight and cancer. What this slide shows is actually there are evidence that 13 different types of cancer are associated with cancer. And these 13 types of cancers, they make up 40% of all cancers diagnosed. About 2 in 2 occur in adults 50 to 75 years old. Most types of these cancers associated with overweight increased from 2005 to 2014. More than half of Americans don't know that overweight can increase the risk of cancer. So, Alzheimer's is a big chronic disease, and also it's a huge cause of death. So what is Alzheimer's? Alzheimer's basically is a type of dementia that causes problems with memory, thinking, and behavior. Symptoms usually develop slowly, and they get worse over time, becoming severe enough to interfere with daily tasks. So this slide basically shows the MRI of a normal brain and Alzheimer's disease brain. You can see how the structures of the brain, especially the ventricles, they get bigger, and there is a loss of brain tissue, basically. Alzheimer's disease is the most common cause of dementia among older adults. 5.7 million Americans are estimated to be living with Alzheimer's disease in 2018. They were. This shows how Alzheimer's may shrink your brain, especially the cortex. And as you can see in the bottom of the picture, the hippocampus, which is where we actually store memory. Alzheimer's disease is the 5th leading cause of death in adults age 65 and older. Alzheimer's death rates increased 55%, and the number of Alzheimer's deaths at home increased from 14 to 25% from 1999 to 2014. We don't really know what causes Alzheimer's, so unknown causes, but the theories are that inflammation, diet, like an important for people to develop Alzheimer's. The next big chronic disease is diabetes. Diabetes is the leading cause of kidney failure, non-traumatic lower limb amputation, and new cases of blindness among adults in the U.S. Each year, the cost of diabetes and its complications and associated diseases continue to rise. In addition to the tremendous toll diabetes takes on individuals and families, diabetes has a significant impact on the workplace. We spend more than $245 billion in 2012 just to taking care of diabetes. Just an example, the market for insulin is worth $20 billion, just insulin. and you have only maybe 5 players, maybe 5 pharmaceutical companies who make insulin. So what is diabetes? We basically have, 3 types of diabetes. Type 1, the one that you get when you're a kid, because the cells of your pancreas are destroyed, so they no longer make insulin, and you need insulin to process food, and insulin is also important in other areas of the body, like regulating energy. Without insulin, we die. So we have type 2, or adult onset, basically caused by lifestyle. You eat a lot of sugar, your pancreas gets tired of making insulin, so you might need a drug, or you might need actually insulin. And we have the gestational diabetes. Some pregnant ladies may get gestational diabetes for 7 different causes. There is a theory that Alzheimer's is actually the so-called diabetes type 3. But we don't have hard evidence for that yet. It's just a theory. So we talk about a few chronic diseases like heart disease, cancer, Alzheimer's, diabetes. But what causes chronic disease? What is behind all these illnesses that cost a lot of money to treat, and we don't have success in treating? One of the main causes of chronic disease is actually inflammation. Inflammation itself, it's a vital function of your immune system that's triggered like immediately when it detects an invading pathogen or damaged tissue. So that's the normal inflammation we have. If we have chronic inflammation, then we have an ongoing process of trying to repair damage that never ceases. So it creates many other problems. I love this slide because this was a Time magazine cover. I believe 2012. I might be wrong, and it talks about the secret killer that it's inflammation, and how inflammation will cause a plethora of chronic diseases. This slide shows a normal inflammation or inflammatory process, that everything started with like a damage or invasion, and the immune system works in a way that will try to prevent the damage, repair, and take care of either invasion or the damaged tissue. We have, like I mentioned, we have acute inflammation and we have chronic inflammation. If the threat remains and the immune system response is constantly triggered, the inflammatory response can continue and damage the body instead of healing it. That's basically what chronic inflammation is. So how do we prevent chronic inflammation? And the answer for that is actually we can prevent chronic inflammation by having a good diet, by exercising, and also looking into some sort of stress management or reduction, and also sleeping enough. Also in diet, it means also that you drink enough water as well. So there are many ways to increase your or reduce your inflammation, chronic inflammation, by eating anti-inflammatory foods. But you can increase your chronic inflammation by eating foods. In this slide, I list at least 17 foods that are highly inflammatory. For example, sugar, soda and sports drinks, trans fats, hydrogenated oils, milk, fried foods, grain-fed meats, processed meats, alcohol in high amounts, refined carbohydrate, gluten, artificial sweeteners, MSG, preservatives and colorings in the food, ready-to-eat meals, personal food intolerance, and that's the only thing that sometimes you don't know. You have an allergy to a food and you keep on eating that. That might create inflammation in your body. So diet is so important that we have many studies in how diet can cause inflammation and how diet can be the medicine for inflammation. If you eat the wrong food, if you have the wrong diet, you're going to create in your body what we call stress. And what oxidative stress is basically you create a whole bunch of free radicals. But then what are free radicals? Free radicals are molecules that lack an electron. So they have to scavenge the body to steal an electron from other molecules. And this process usually happens inside the cells, and it's like a domino effect. So one molecule lacking one electron goes and steals from the other one. That one steals from the other one, and goes on and on and on. And that process damages cells and may damage the cell's DNA. If you remember, I mentioned that cancer might start a cell that has a DNA that was damaged, repaired, or it wasn't deleted. So it becomes like a cancer cell. So that's basically what I'm showing here in this slide, is that free radicals are basically unstable atoms. They become more stable. To become more stable, they have to take electrons from other atoms. The result is more free radicals, more oxidative stress, more damage to the cells, which leads to degenerative processes, as well as aging. Aging is actually the result of having too much free radicals in the body. We have too much poisons in our food. And this is just to illustrate one, and this was published in a paper in 2010. There is an agent called acrylamide, which is one of the 100 chemicals known as what we call Maillard reaction products. When we cook, it is what make in a chemical process the food to become like brown. But these chemicals, they also cause what we call advanced glycation end products, and the acronym for that is AGES, AGES, and that's kind of not to make a punt, but these things make us age faster. And they are created when acrylamide and other Maillard reaction products that we find in food bind to protein in the food and permanently. Then they create more advanced glycation products. Advanced glycation processes are also implicated in some cancers, definitely in chronic inflammation and other diseases, including Alzheimer's. There is a definite good benefit in having a good diet and also have a good exercise program. So we call whole food nutrition and whole effort at exercise. So we have benefit You have many benefits from having a good diet, many benefits from exercising. But we have this amplifies when you have when you incorporate like a whole food nutrition with whole effort exercise in your life. I like to show this study because it shows, this study actually shows that fruits can have multiple functions, and mainly an anti-inflammatory effect because fruits and vegetables are rich in antioxidants, and basically antioxidants, they have, remember when I mentioned about the atom with lacking one electron? So antioxidants, they have an extra electron. So when you combine an antioxidant with a free radical, you basically you neutralize the free radical. So antioxidants are actually the medicine for free radicals. Where do we find antioxidants? Basically all the colors in the diet, in the fruits, the veggies, and they're all rich in antioxidants. And this study shows that. In terms of exercise, there is mounting evidence based on epidemiologic and experimental studies that physical activity and exercise training combat exercise training, combat the sequels of aging. So if you exercise, you will slow down the aging process. Numerous studies confirmed by meta-analysis indicate that exercise training reduces cardiovascular mortality. Exercise and regular physical activity counteract the negative effects of aging, not only by combating overweight and sarcopenia, which is the opposite, and also mitochondrial dysfunction, which are the major triggers of oxidative stress that I mentioned earlier. The next thing is stress. Stress influences food choices. Stress can enhance metabolic responses to unhealthy meals. And wrong diets may impact mood as well as be pro-inflammatory and also cause more stress. But what is stress? Stress is primarily a physical response. When it's stressed, the body thinks it's been under attack and switches to fight and flight mode. This is done by the autonomic nervous system without you really knowing. So when you go to the fight and flight mode, it releases a complex mix of hormones and chemicals such as adrenaline, cortisol, norepinephrine, to prepare the body for physical action or for the attack. But if the stress is chronic, you have all these biochemical reactions happening all the time. And what this study shows is basically that there's a common pathway for stress-related diseases and chronic inflammation. So there's a link between chronic inflammation and chronic stress. So the next stop is sleep. Sleep is very important, as you all know. Many of the chronic diseases we have might happen because of a chronic lack of sleep. In this study, sleep disturbances, including insomnia, contributed to the risk of inflammatory disorders and major depressive disorders. Together, interactions between sleep and inflammatory biology mechanisms underscore the implications of sleep disturbance for inflammatory disease risk and provide a map to guide the development of treatments that modulate inflammation, improve sleep, and promote health. So this is a slide that shows how much we should sleep, and this data I got from I believe it's CDC. So if you are a newborn, you need to sleep anywhere from 14 to 17 hours. But for most of us, 7 or more hours per night is what is indicated. The consensus is for adults is 7 hours. So we talk about chronic diseases and we talk about a few strategies to prevent chronic disease, such as diet, exercise, stress management, and sleep. So I want to show what I also do clinically to treat chronic disease. I use a technology called electroacupuncture according to Vol. And so using this technology, what I do is I measure points in the hands and in the feet. And those points, as I will show later, are associated with organs in the body. By measuring these points, I know what organ or tissue of the body has an abnormal reading. This is a picture of the device, the meter that I use to measure the points. This is how it looks like, in terms of what happens there. It's basically an meter, and so we are measuring resistance. And these are the points that we measure. So as you can see in the picture, there is a point for the lung, then the next point is a point for circulation, then we have a point that measures the nervous system, and on the other side, on the pinky finger, you can see a point that measures the heart. These are just examples because in a full electroacupuncture, according to Vol session, I measure 10 points on each hand and 10 points on each feet. These are the foot points. So you see pancreas, then liver, then stomach, and kidneys. But I measure, like I mentioned, other points. The measurements we look into 3 different ways. We can have a very low measurement, which indicates that there is some sort of degeneration happening there. The meter that shows in the middle there, it's basically it's a normal measurement, and the meter on the left side of the screen is actually showing like a higher reading, which is we believe is more like into the inflammatory area. This is basically how we measure. We measure the points, and if the points are showing a normal reading, then we move to the next point. And after measuring all the points, that's the kind of chart that we generate. If you look at the chart, abnormal points will be listed, plotted in gray. The red means the right side of the body. The blue bar means the left side of the body. And after having all these measurements, so I will come up with a treatment plan to neutralize those gray areas in several different organs. So to do that, what I basically do, I use natural medicines, basically homeopathy, and I will use those medicines going back and test each point that was abnormal and trying to make the meter go to the normal reading. During an EAV test, an electroacupuncture according to volt test, what we basically do is we try to balance the abnormal points. And we can do that, and that's what I really like about this technology, because I know that what I'm balancing the point with is effective even before you take it. And the substances that we use are basically all natural, no side effects, or they don't have adverse reactions. They don't cause any harm, because that's the very nature of homeopathy. We also use scalar treatments. Scalar treatments basically use a scalar field created by Tesla coils, and what it does is realigns the nervous system. The theory, the scalar theory in healthcare is basically pointing that our cells communicate to each other using scalar waves. So by being in a scalar field, we actually are realigning that energy to work without blockages. We also measure antioxidants, and this is very important because a lot of people, almost everybody is taking a supplement, but you don't really know if it's working. And this is the best way to verify that, because when you measure your antioxidants, if you whatever you take in and your number is not effective, not good, so it means that you wasting your time and money. And then we want to put you on an effective antioxidant that will definitely counteract free radicals and fight inflammation. We also measure how old your vessels are from inside. We use this technology called photoplethysmograph. And what it does is it detects changes inside the vessels, what we call endothelium. And the endothelium can be all damaged because of lifestyle, high blood pressure, poor diet, and by assessing that, we can actually later fix it. So this is, in a nutshell, the things that we do in order to treat chronic disease, despite diet, exercise, good sleep, and stress management. This is my book. It's on Amazon. It's not like for the lay people, but if you're interested, you can take a look at it. And this is our clinic. We do have a Facebook page. Please like it. Thank you so much for your time in watching this. I hope that you enjoyed and that you take the steps necessary to to have a better diet, to exercise more, to sleep enough time, to keep you hydrated, also to manage your stress. Thank you again, and God bless you.